If you're having pain or weakness in that posterior rotator cuff area back here, I'm going to show you some techniques that you can do to try to improve your strength, range of motion, and help with your pain. So with that rotator cuff pain on the back side of the shoulder, that posterior cuff, so that's that pain around the back side here. A lot of times people complain of pain there. It may radiate down the outside of the arm, maybe down by the elbow. I've even seen it come down in the hand. It's not as common with the posterior cuff or the back side of the shoulder. That's typically going to be the infraspinatus muscle and the teres minor muscles. And so a lot of times you're going to have that pain back there, and it hurts to lie on it at night, sleep on it, you roll over on it. All that's painful, especially putting your hand up behind your head. That functional external rotation movement there, that's uncomfortable. You know, a lot of times patients will say that when they wash their hair, they're kind of bent over, and so they don't have to try to bring their arm up as high. And so a lot of times with that, there are some things that you can do if it's, whether it's just inflamed or whether it has a partial tear. So there are some options. So if we're looking at, this is going to be a right shoulder blade or scapula. So we're not going to make fun of my drawing here because, yeah, I'm kind of known for not doing real well with my drawings. And so this is going to be the shoulder blade here, and we'll actually make a little bit of a glenoid fossa there. Now this is obviously not anatomically accurate because you would have the acromion process, the spine, the scapula, all this stuff you'd be seeing here, but just for the purpose of my drawing and video, we're going to keep it simple. Now you're going to have the humerus, right? So there's the arm bone, the humerus here that's going to come down, and that's going to come down here and attach here at what's called the glenohumeral joint. Now we're looking at a right shoulder blade or scapula, right humerus, and so the person will be looking away from me. So we're looking at this on the back side of the posterior side. Now we're going to add in the infraspinatus. So the infraspinatus is going to take up the bulk of this area here. It's known as the infraspinous fossa. Comes over and attaches. So that's infraspinatus. So we'll kind of give it a infra right here, and that's there. And then the teres minor muscle, which is going to be below that. The teres minor is a smaller muscle running right along the bottom here and then attaching, and that's going to be teres minor muscle. So those are the two rotator cuff muscles that are going to make up the posterior cuff here. Now, a thing also to mention with this is you can have, again, tearing in this, not full thickness tears where it's all the way through, but partial thickness tears you can have, and you can still function. You can still use the arm. It doesn't always require surgery. Now, in some cases, if the pain is just unrelenting and you can't get it any better, you're losing function and strength, then you may have to have surgery. But there are some things that you can do to try to, improve the stability of the cuff and the strength, as well as then overall functional use of your arm without having to have surgery in a lot of cases. So I'm going to show you some exercises you can do to try to improve your range of motion and your functional use of your upper extremity. So for range of motion, one of my favorite things to do are tabletop slides or countertop slides. You take a pillowcase. We're going to say it's the right shoulder. I'm going to put my right hand down first. I'm going to put my left hand on top of that so I can kind of control it and then also help with the movement. And I'm just going to lean forward just like this and kind of lean into this, bending at my trunk and then coming back. Just working on that in range of motion, because we're going to also assume that more than likely you have limited ability to reach overhead. So we're just going to use this exercise to try to work on that range of motion for reaching overhead. I repeat this for maybe 2-3 sets of 15 to 20 repetitions. Now also with this, if you have trouble with the reaching forwards, if that causes too much pain or pinching sensation in the shoulder, what you can do is just place your hands in whatever position you want to be in, and then either, if you're I'm on a rolling stool now, but you can roll back or walk back and lean into that, and then you're indirectly creating the range of motion that you want without having to reach forward. So you just kind of fix your hands in place, and then you back up away from the surface to do the same thing with the range of motion. Now we're going to work on resistance training for the posterior cuff, or that back part portion of the rotator cuff. So we're going to say it's my left shoulder that's affected here. I have a band here that's attached over to a power rack. You can use any sort of band that you'd like. It doesn't really matter. These bands are from Crossover Symmetry, but again, you can use whatever kind you like. So we're going to start off with kind of a modified isometric. I call them isometric walkouts. So I have my elbow tucked into my side here. I'm just going to step out a little bit, a couple of steps, and then I'm going to go back to my right, and then step out again a couple of steps, just focusing on keeping my elbow tucked in, kind of controlling this, not letting the band pull my hand in. If that's too much, you can start with a lighter resistance and then work your way up. And then after I do that, maybe for a week, maybe 2 weeks, things are feeling a little better, it's not as painful, and then I'm going to start doing what's called an isotonic exercise where there is movement. Call this kind of opening the gate or opening the door. So I'm just rotating my shoulder outwards, my hand outwards, keeping my elbow tucked in. If you have trouble keeping the elbow tucked in, you can take a towel, roll it up, put it under the elbow, and do that same movement. Repeat that for 2 to 3 sets, 10 to 12 repetitions. Now also, you don't have to use a towel and you don't have to keep your elbow, tucked in nice and tight. But what I find what starts to happen a lot of times is the patient, or you'll start doing this kind of movement here, and that's not the movement we want. We want to be able to work that posterior rear cuff because that is external rotation and that is a function of the infraspinatus and teres minor muscles. So again, start off isometric walkouts and then work into those isotonic where there's movement just like this. Next, we're going to perform scapular retraction or rows. You can call these all different things. And so if you're in the gym, these may just be rows, a rowing machine. You can use a machine. You don't have to use a band. So you can use a machine. You can use a cable system, kind of whatever you have. But again, we're going to go back with the band here. My elbow is going to stay pretty close to my side. And I'm just going to pull back, really squeezing those muscles on my back on that left side or on the affected side. I'm just going to pull back. I'll hold that maybe 1-2 seconds and come back forwards. I'd repeat that for 2 to 3 sets of 10 to 12 repetitions. And as always, even if it's my left shoulder that's the affected side, I'm going to always train the unaffected side as well because there's some research that supports, kind of working both sides can have an effect, an improvement on the side that is affected. Plus, it just adds for good symmetry and balance. Now we're going to perform chest presses. I'm going to make this my right shoulder. It's affected just for camera purposes. So it doesn't really matter which side because again, remember, we're going to always work both sides. I'm going to have the band fastened back here. This doesn't matter if this is bands, it can be a machine, whatever that you have access to. And I'm just going to push forwards just like this. Now, something to remember with this is when your elbow drops back past the shoulder. So if I'm creating a line here straight outwards, and my elbow drops back, I'm putting a lot of strain on the shoulder joint. I'm not saying that's bad, I'm just saying use a little caution with that. Initially, you may just want to bring it back to where the elbow stops at about shoulder, even with my shoulder, and then coming out, and then eventually work to going all the way back. That's fine, just whatever feels best to you. But I would complete 2 to 3 sets of 10 to 12 repetitions of that movement. And now we're going to go into scapular protraction. So with this, or serratus punches, all different terms for this, I'm going to keep my elbow straight. So the trick with this is now there's no bending of my elbow. My elbow is straight, and I push forwards, and I come back. Just kind of drop back in the shoulder joint itself, keeping my elbow straight, not bending my elbow. So I want to do this exactly. Reach forwards, and then come straight back. That one's a little tricky to kind of master, but once you kind of do it and you figure it out, it does get easier. So repeat that for 2 to 3 sets, 10 to 12 repetitions. Next, we're going to do internal rotation. So I have my elbow by my side here. I'm using a band, has the handle on it. I'm going to pull this in just like this. We're going to pull in here. Even though this is a posterior cuff or rear cuff issue, we're still going to work the entire rotator cuff complex. So you want to make sure, keep this nice and tight here, pull this in. If this is too painful, although this typically would not be as uncomfortable as going outwards, that external rotation, you can start with isometric walkouts with this, elbow tucked in, and then just stepping out and stepping back in. That's not as common because that's going to be the subscapularis muscle, and that's not going to be involved with a posterior cuff dysfunction or with tearing. But if it is uncomfortable, just the movement back and forth, you can start with that isometric walkout. Just keep the elbow tucked in. Repeat it the same way, 2 to 3 sets, 10 to 12 repetitions. After that feels a little better, you're more comfortable with it, less pain, maybe a week or 2, then you can go into that isotonic or where there's internal and external active movement going on. Now we're going to work the supraspinatus muscle that runs across the top. So I have an exercise band here with a handle. It's fastened down to lower surface. And what I'm going to do is bring this up to about shoulder level and back down. Now, with this, I'm not performing a pure abduction. So I'm turning to the side. I'm not bringing my arm straight out to the side. It's more of like kind of in front. So not straight out to the side, not straight in the front, something that's called a scapular plane. So I'm going to bring this out nice and slow, 10 to 12 repetitions for 2 to 3 sets. And again, as always, I repeat this on the other side as well. Now, I always like to add in a couple of stretches or mobility work with this. And so the first stretch you're going to do is pull the arm across your body like this. You're going to stretch the back side, feel this back there, pull and hold that for 15 to 30 seconds. I repeat that for several times just throughout the day. That just does really nice at stretching that back side of the shoulder to give you a little bit of relief. This stretch I really like where you grab the bottom of a chair, so I'm holding on the bottom of the chair and I'm leaning away and I really feel that pull, that distraction pull in my shoulder joint. Distraction or that pulling usually feels pretty good within the shoulder joint, and I'll hold that for anywhere between 15 to 30 seconds and just repeat that throughout the day. The last thing we're going to add in is I put a tennis ball inside a pillowcase. You know, I like this technique a lot. And you're just going to take that tennis ball, put it on the back side of the shoulder there in that posterior cuff where that pain is, put it against the wall and really just lean into it. Just hold that pressure. You can do this in standing or you can lie on the floor, just whatever you're most comfortable. Just hold that pressure in there. And I hold it somewhere between maybe 10 seconds, 30 seconds, a minute, just really whatever feels best to me. And then relax, and I repeat that again just throughout the day. I hope these tips help to try to reduce your pain that you're having on the back side of your shoulder, that posterior rotator cuff pain, and improve your functional use of your upper extremity. Thanks for watching.